Hello, my name is Mercedes Herrera from the University of California, Irvine, and today I'm presenting my poster titled Investigating Bulbar Motor Severity in NT5c1A Seropositive and Seronegative IBM Participants from the INSPIRE IBM trial. I do not have any conflict of interest associated with this poster. To give a brief synopsis, inclusion body myositis is a slowly progressive acquired myopathy characterized by proximal and distal muscle weakness and inflammation. Anti-NT5c1A antibodies are common in patients with IBM, thus becoming the first serological biomarker for diagnosis. Prior research investigating the potential relationship between serological status and disease behavior suggested that seropositivity to NT5c1A antibodies prognosticated a more severe clinical phenotype, specifically more severe motor weakness and bulbar involvement. However, subsequent studies reported no significant clinical pathologic changes between seropositive and seronegative IBM patients. The debate remains whether serological status may provide insight into functional severity and disease behavior, and given the paucity of research, this renders motivation to reinvestigate the hypothesized relationship in a larger cohort. INSPIRE IBM study is a prospective NIH-funded observational study that includes patients ages 40 years or older with clinically defined IBM fulfilled by the ENMC 2011 criteria and disease onset within the past 10 years of baseline visit. This analysis included 140 participants where we collected serology for NT5c1A and functional assessments at baseline. Those functional assessments included manual muscle testing, timed get up and go, Sydney-Sawell questionnaire, and EAT-10 self-reported measure. Out of the 140 participants, 69 were seropositive to NT5c1A antibodies and 71 were seronegative. Patients were divided into two groups. Group A with disease duration between 0 to 5 years is represented in Table 2 on the left, and Group B with disease duration between 6 to 10 years is represented in Table 3 on the right. For both groups, 2 sample t-tests were performed to compare functional assessments and serological status. Our analysis showed that seropositive Group A had significantly greater difficulty swallowing than seronegative Group A. Seropositive Group B showed a trend towards more difficulty swallowing through the EAT-10 and SSQ and motor function weakness with respect to MMT compared to the seronegative group, but did not reach statistical significance. In conclusion, seropositive IBM patients appear to have more swallowing difficulties than seronegative patients, and this difference appears early on in the disease course. Due to the slowly progressive nature of IBM, there is a robust need for observational longitudinal studies to further investigate whether NT5c1A antibodies mediate disease progression over time. And lastly, here is a list of my references. Thank you.